Hi, I will talk today about a global epidemic called coronavirus. Coronavirus are a family of viruses that can cause illnesses, such as a common cold, severe acute respiratory syndrome, and Middle East respiratory syndrome. In 2019, a new coronavirus was identified as the cause of disease outbreak that originated in China. The virus is now known as a severe acute respiratory syndrome coronavirus 2. The disease it is causes called coronavirus disease. In March 2020, the World Health Organization declared the COVID-19 outbreak a pandemic. Signs and symptoms of COVID-19 may appear in 2 to 14 days after exposure and can include fever, cough, shortness of breath, or difficulty breathing. Infection with new coronavirus causes coronavirus disease, also known as a COVID-19. The virus spreads by respiratory droplets released when someone with virus coughs, sneezes, or talks. It can also spread if a person touches a surface with the virus on it and then touch his or her mouth, nose, and eyes. The disease can cause severe medical complications and lead to death in some people. Complications can include pneumonia in both lungs, organ failure in several organs. Due to its high sensitivity, CT can detect the abnormalities in the lung, such as a coronavirus. The CT play a major role in COVID-19. Triage of patients, prediction of worsening, prediction of improvement. The CT used in some cases such as a clinical suspicion in patients with negative PCR. CT is not recommended as a first-line tool against coronavirus, because chest imaging overlapping with similar findings for infection. Imaging rooms used by a patient suspected of having the virus need to be cleaned and decontaminated following each visit. PCR testing is the only specific diagnosis method, but it has limitations. Limited availability of PCR testing kits, long time to wait the result. Because of these two reasons, CT can be useful in triage and diagnose the patients. If patient has symptoms of COVID-19, should be isolated until the result of PCR. High sensitivity and accuracy to show lung lesion, allow differentiation of vessels and soft tissue and air filled from infection, overlapping structure are eliminated, multiple images are collected from many angles, good spatial resolution, temporal resolution. High doses of radiation are involved in CT scanning, artifact is common, requires breath holding which some patients cannot manage. Saudi Arabia has been facing so many challenges with the COVID-19. They applied the quarantine for 24 hours in most of the country, so people can stay home and minimize the possibility of the virus spread. With the days passing by, the number of the people who get it infected is decreasing. They also put strict rules about it. Saudi Arabia has taken this virus seriously and acted immediately. The schools are now online, and the government made the infected patients stay in a hotel for isolation and treatment. The medical workers are sacrificing their own life for helping infected patients. The Kingdom of Saudi Arabia, as always, was on time and at responsibility level, as it has implemented the necessary procedure to reduce the risk of coronavirus. Unlike other countries that were late in making decisions until the disease spread to them, We have the best example in Italy and Spain, and what happened to them. Chest CT is a routine imaging tool for pneumonia diagnosis. It's fast and relatively easy to perform. Recent research found that the sensitivity of CT for COVID-19 infection was 98% compared to RT-PCR testing sensitivity of 71%. So chest CT had higher sensitivity for diagnosis of COVID-19 as compared with RT-PCR, but RT-PCR has better specificity than CT because CT can't differentiate between viral infection. There is no vaccine available to prevent infection with the new coronavirus, but you can take steps to reduce your risk of infection. Some of these steps are: avoid close contact within about 6 feet or 2 meters with anyone who's sick or has symptoms. Avoid touching your eyes, nose, and mouth. And wash your hand often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% of alcohol. Finally, in order to overcome this epidemic, please stay at home.